Good afternoon, everyone. Thanks for joining. For many of us, perimenopause often is seen as a time of unavoidable discomfort from things like hot flashes and mood swings to fatigue and multiple sleepless nights. But what if I told you that these changes aren't just random or something that you need to ride out? What if they're your body's way of telling you that something deeper is out of balance? Today, that's what I want to explore the idea of perimenopause through this lens of functional medicine, where we look beyond just managing symptoms. The type of way that we practice, we look deeper into underlying causes of the changes you're experiencing, whether we're looking at your hormonal shifts, nutrient deficiencies, blood sugar dysregulation, or chronic stress overload. All of these eventually lead to the chronic low level inflammation, which is at the heart of nearly every issue we suffer with over the lifespan. This becomes especially more important due to the estrogen changes associated with female aging. It's about personalized care, turning into your unique body's needs and empowering you to regain control of your health. This transition can be a time of profound transformation, and with the right tools, you can not only navigate through it, but truly transform through this period of your life. The argument I want to make tonight is that our choices primarily dictate our outcomes, that we have so much control over the results we get in our life, but that there are certain key things that we tend to do in a day-to-day basis that end up sabotaging these efforts that we're giving. I'm Dr. Mitchell Rasmussen, the co-founder of the facility Denver. Tonight, that's what I want to talk about with my co-founder Kate, who's a clinical nutritionist. We want to talk about what can be done to navigate through this period in our lives so that we can truly have an amazing last half of our lives as a postmenopausal woman. Just a few disclaimers here. We're informational purposes only. This is not taking the place of medical advice. We know this is a complicated, individualized experience, and always consult with your healthcare providers to get your specific treatment options. Many of you, I'm sure, have heard of functional medicine, and oftentimes it's thought of as a way of digging deeper into your biology in order to try to figure out what's actually going on. Symptoms are oftentimes an end expression of underlying biological, physiological perturbances. That being said, one of the best parts about what we do is we really get to know our patients and we truly give them the time to be able to share their story. Oftentimes you hear us saying things like everything is connected, everything matters, and everybody's different. Without that approach, oftentimes things are missed. And that happens all the time in a mainstream medical model where not enough time or energy is given to that initial investigation. That's where the personalized care comes in. When we think about root cause analysis, oftentimes it's thought that there might be one or two main causes of people's issues, but what we tend to find in it is it's the conglomeration of all of the lifestyle factors from chronic stress and poor sleep patterns and dysfunctional relationships, lack of gratitude and joy, chronic infections, mold exposures, heavy metals, tick-borne illnesses, and the like. There's oftentimes not going to be just a single smoking gun. And that's, I would say, what makes what we do so much fun because everyone truly is a little bit different from the person next to them who may have the same diagnosis. The holistic approach takes into mind how all of our pieces are connected. There's no sense in separating our chronic stress from our skin issues or our poor sleep patterns from our inability to exercise, which causes blood sugar dysregulation and weight gain. It truly is a holistic approach that pulls into focus all the little things that eventually work together to become the big things. And then we're always looking at prevention. Unfortunately, for most of the people that we see, they've been suffering for so long that no longer are we thinking about prevention so much as we're thinking about what we need to do to help back this person off the ledge. Preventative focus is always the goal, but oftentimes we are intervening on their behalf when there already is a problem that's occurred. I like to talk a lot about how we're different. And a good example is blood sugar dysregulation. On a standard blood panel, as long as your blood sugar is somewhere between 70 and 100, you're considered A-OK. Same when it comes to our hemoglobin A1C, which is a marker of average blood sugar over the last 3 to 4 months. If you go to your standard doctor and your A1C is under 5.7, they're probably going to tell you that everything is A-OK. But what we know based on the literature, that any A1C over 5.4 is telling us that there's shrinkage of the brain, there's developing insulin resistance, and there's absolutely many things leading you to more medications in the future that we could deal with right now. And that's really where it comes into the preventative focus. We find people's blood sugar dysregulation starting years before something like prediabetes or diabetes occurs. And that's the spot that we'd like to intervene, because that's when our tissues in our bodies still have a great capacity for healing. So we're not looking at disease ranges so much as we're looking at optimal ranges. And that's really where the science is taking us these days, that we want to optimize. We don't want to just not be on a medication. This is pretty much what we look at for every single patient in the Western world. We see cardiovascular disease, neurodegeneration, such as Alzheimer's and dementia. Cancer is a top killer. And the reason I put the metabolic diseases on here, no, diabetes is not the number 4 killer in America, but what we know about insulin resistance and metabolic dysregulation and all of the systemic effects of that is that you're much more likely to die of those top 3 things. So these are really the things that we're screening for and looking out for in most of our patients. And when it comes to the postmenopausal woman, we know these are the issues that develop after menopause, and there's absolutely a component of estrogen that's involved here. One thing I want to say about estrogen, hormones are not the end all be all when it comes to helping a postmenopausal woman stay well. They are something that should be considered, but there's a lot of what we call metabolic backdoors. For example, we know that your circadian rhythm, which is what governs your sleeping and your waking and your stress management, is much more impacted and sensitive to stressors in your life when you have less estrogen around. But that doesn't mean that you're incapable of having adequate circadian balance. And that's where we come into meal timing and exercise timing and certain nutrients, where we can really help the system create a circadian rhythm, is almost a backdoor to this inability to have estrogen's regulatory effects on that system. And we'll continue talking about that more as we go. This is essentially what we're after with every single patient that comes in our door. Inflammation saves our lives. Inflammation is how we fight infections. Inflammation is how we get over bone fractures and sprained ankles and torn hamstrings. But that's not what I'm talking about when we talk about chronic inflammation. My argument to you is that chronic inflammation is the root driver of every single disease that ails the Western world. When we think about chronic inflammation, we think about a smoldering forest fire. When we think about it, the amazing life-saving effects of an acute inflammation after an injury or an illness, I like to call that a blowtorch. It's very aggressive and it's very specific toward whatever is driving the response by the immune system. In chronic inflammation, it now becomes a smoldering forest fire where we're not able to really quench the threat that's happening, because there's so many factors that are adding on, that are creating this inflammatory programming. And that's what I want to kind of go into on this next slide here. This is where we tend to intervene with as many of these root cause drivers as possible. When we think about primary drivers of chronic illness, a little bit of a complicated chart, but this is where we really get into the idea that everything influences everything. These top left orange boxes, those are some primary treatment of targets that we're after. We think about the inability to detoxify. If someone has chronic mold illness, we know that the liver and the gallbladder really take a beating with that. So now we can't detoxify things like the synthetic estrogens in our fragrances and in our water and in our plastics. And we're not able to drive healthy detox results simply because there's too many things that are ailing the system all at once. Blood sugar dysregulation is a chronic driver of inflammation, and we see the same thing with food and environment. If you're chronically eating a food that you're reactive or allergic to, this will create that low level GI irritation that we were talking about earlier, that then promotes and reinforces the inflammation associated with all the other things that we deal with. That's really the issue. We are not dealing with one big threat. Typically, what we're dealing with is death by 1,000 paper cuts, where there's so many factors that are adding up to turn this wheel of inflammation. So it makes sense that taking something like turmeric for your inflammation is not going to be enough, because we haven't addressed enough of these other causes. When I think about hormonal effects, we know that estrogen is profoundly healthy at helping the body deal with inflammation. Same with progesterone. We also know things like vascular issues. We're over here in Denver, Colorado, and we see a lot of people at altitude who become more inflamed simply because they have a chronic low level iron deficiency, which might be driven by their gut dysbiosis or their small intestinal bacterial overgrowth. And now this low level iron deficiency becomes a reinforcer of the high altitude, which drives the inability to create oxygenation in your tissues. This is how things add up again. When we think about others, we think about all sorts of nutrient deficiencies. We think about heavy metal exposures and mold toxins and Lyme disease and so many of these things that we end up digging into via advanced blood work after that initial history. So when I sit down with a patient, we're inventorying on top of these things, but these are the most common things that we inventory, from blood sugar and diet and detoxification, hormonal state that we're at. That's going to be something that we test in every single patient. We look for things like anemias, iron deficiency, and B vitamin deficiencies that can drive poor vascular blood flow and oxygenation. And then we, through a history, really dive into if there needs to be an investigation into mold poisoning or tick-borne illness and things like that. When you look at the inflammation, what you'll see is a two-edged arrow going between it and all these other factors like brain inflammation, autoimmunity, stress chemistry, and gut dysbiosis. In the short term, stress is profoundly anti-inflammatory. You get a massive release of cortisol about 4 minutes after the stressor, and cortisol's job in the initial phase of the immune response is actually an immune suppression. That's why things like corticosteroid injections or prednisone taken orally are profoundly anti-inflammatory in the short term. But as anyone who's been on them multiple times or for a long period of time knows, eventually they become much less effective. And this is due to the results of the chronicity of the stressor, of the high cortisol, that eventually the body becomes resistant to the effects. So it's not so much that cortisol becomes inflammatory long term. It's just simply that your cells lose the ability to be sensitive to the cortisol signal to the body of anti-inflammation. So then you're stuck with the original inflammatory driver from all of the adrenaline release during the chronic stress. This is what we call all gas, no brakes. So many people exist in this phase where they're chronically inflamed, chronically stressed. They're stuck in that wheel. They're not doing enough to push back on it. And then always, eventually, every single time, without fail, the brain will become inflamed. We always say gut inflammation leads to body inflammation. Body inflammation every time leads to brain inflammation. When the brain is inflamed, the person becomes fatigued. The person becomes almost hungover or asleep at the wheel. They have poor ability to get out of bed in the morning. They might be depressed. They might be anxious. They might have intrusive thoughts. They might even have more food cravings. They might even have an inability to exercise. They might have brain fog. All of these are common symptoms as part of the postmenopausal picture that are often attributed solely to the loss of estrogen, but that's simply not the case. There's so many other factors that are reinforcing that concept of brain inflammation. There's so much more that we say with our patients on this slide, but I think for the context of this talk, let's leave it at that for tonight. Here's some numbers when we think about perimenopause. Average onset, mid to late 40s. We see that range all over the place, as you might have experienced. There's ovarian failure much earlier in life for some people, and we have women that are still cycling all the way up into their mid 50s. One thing I'll say about this, and we really instill this idea into every perimenopausal woman that we're working with, If we can help your ovaries stay online for even 2 extra cycles, the the effects of long-term estrogen withdrawal, like bone density loss and heart disease risk and cognitive decline and frailty and fragility, all of those things can be mitigated for many years in the future. So even just 2 extra menstrual cycles for a woman has years of beneficial effects beyond that. The average duration, essentially, menopause is a moment in time, right? The classical definition is you've gone 12 months without a menstrual cycle. That becomes a moment in time, but really it's a slow change in the ovarian function and the output of the estrogen. That is what really signifies that 4 years is the average duration. So many women, 3/4 to maybe more, experience things like flushing and heart palpitations and hot sweats and anxiety. And unfortunately, some of that is often unavoidable because of the estrogen declines. But we know if you're chronically stressed at the same time, those vasomotor symptoms are going to be multitudes worse than if you had dealt with the stress issues going into this phase of your life. So we always say, a woman heading toward perimenopause must have her adrenal balance in order, or else it's going to be quite the wild ride. The mood changes. We know estrogen and progesterone's balancing effects on mood. Progesterone, which comes from an egg that becomes ovulated in a menstrual cycle, is highly balancing of the circadian rhythm. We have plenty of data to show that an inability to fall asleep at night for a perimenopausal woman oftentimes has to do with progesterone deficiency. Progesterone can only really be coming about from the egg itself. So that is a common cause of these underlying mood changes and sleep disruptions. The saddest thing that we see is that last number there. This should be talked about more. This time in your life should be celebrated as a transformational time. You might live half your life as a postmenopausal woman, and if you don't feel well, ask for help. And if that person ignores you or scoffs it off, as I said in the beginning, as an unnecessary discomfort, find someone who will listen. There is so much that can be done that is not just take exogenous hormones or you suffer. There's a place for them, absolutely, beyond the scope of tonight's talk. But 100%, if you're experiencing some of these symptoms, ask for help and demand that you get better support for these issues that you're faced with. We like this chart, kind of cute. Menopause, there we go. Menstrual cycle, 1 year. That's the American medical definition there. And then we see a lot of these symptoms oftentimes associated in that phase of life. Here's some things that are oftentimes overlooked. You could Google things like, does estrogen help with joint lubrication? Yes, absolutely it does. Does estrogen help with brain function? 100% it does. And same with things like heart balance. We know that palpitations are quite common with the estrogen declines during the perimenopause phase. Bottom line, every system in your body is going to be affected when you're in perimenopause. And here's an example that we created showing those cycles that happen throughout a woman's life. Childhood, very stable and low. During those menstrual years and the reproductive years, we've got cycles that might be anywhere from 22 to 35 or maybe 40 days. And then during perimenopause, it all breaks loose. We've got massive changes. When you see those dips in estrogen, that's when you're likely getting those vasomotor symptoms. Progesterone slowly declines. Again, no ovulation, or ovulation happens much less frequently, so that tends to go down. It's during that perimenopause phase that we really need to dial in all the other drivers of this chronic inflammatory picture so that we can at least stabilize as many of the downstream symptoms as possible so that we're not on such a wild ride here. Another way to look at this is this next graph we're going to show, where we start to add in the brain hormones now. And a hallmark of the postmenopausal state is an elevation of the follicle stimulating hormone, or FSH. FSH goes up, the brain puts that out when it feels that there's no estrogen around. FSH job is to help the woman build a healthy follicle to be released during ovulation. And when that signaling quits happening, there's no feedback from the ovaries up to the brain, so the brain really kicks out loudly with that FSH. We always say a postmenopausal woman, for the first time in her life since she was maybe 9 or 10 years old, has the most stable hormones that she's ever going to have. They might be low, but they are quite stable. And there is so much, we've been talking a lot about the perimenopause state, but there is so much that can be done to help manage the chronic inflammatory picture during that postmenopausal state. But you must have your ducks in a row. I want to look into a little bit of research here, the common things that we see that tend to affect women in this age group. There we go. We've got menopause, transition, and cardiovascular disease from the American Heart Association. We see that, go ahead. We see that cardiovascular disease is a leading cause of death. It might be a little different than the picture in men, but we know that this coronary heart disease will occur later, but it is highly likely to occur post-menopause due to how beneficial estrogen is for the heart. Same thing with cognitive decline. We see this when women go through menopause earlier, they tend to have more cognitive decline. And that goes back to this idea that if we can help you even cycle 1 or 2 more times in your life, you have much less likelihood of having these issues come about. And if they do, they should come about much later in life. We see during the perimenopause phase a lot more anxiety and depression. And that's oftentimes associated with these hormonal fluctuations. We also see how beneficial estradiol is for muscle gain. We know during aging and the menopausal transition in women, there's a progressive degeneration of muscle, both quality and function. And then we know that this decreased proliferation of these satellite cells, which are fused within a muscle, leads to more inflammation. It alters sex hormones and exposes women to this idea of sarcopenia, which is age-related muscle loss. This is where getting your protein in can be so beneficial, because we know as we age, we become much less efficient at taking in protein to our bodies. But at the same time, due to this loss of estrogen, we must do the other back doors in our biology that help us keep the muscle we have. If you have muscle, you stay out of the hospital. And if you go into the hospital, you're much more likely to make it home. I've kind of said all that. And we'll talk about bone in a little bit here. Again, there's those fluctuations. Here's a slide we talk about with all of our women who are dealing with bone density loss. And I say it all the time. Don't blame the victim, blame the perpetrator. It's the same thing with osteoporosis. I don't want to blame your bones for a problem that your metabolic disorder has caused. When we look at this chart, when we look at that top left, GLP-1 is a massive hot button thing these days. We know that GLP-1, when it's those green things, we see that it's stimulating the building of bone, osteoblast build, blast build. When we can stimulate osteoblast development, we tend to decrease osteoclast proliferation, and osteoclasts are what kill bone. Blast build, clast kill. We know things like serotonin are primarily along in the GI tract. Serotonin is often thought as a feel-good hormone, but almost 90% or more of our serotonin in our bodies is actually within our GI tract. Its functions are in motility, as well as signaling to our skeleton that we need to build new bones. So if you have chronic constipation, if you have chronic bloating or gas or diarrhea, we know that you're more likely to have chronic bone density loss. Part of it because you don't absorb nutrients and minerals as well, but also part of it because when you have constipation, you tend to have less serotonin. Serotonin's primary job in the GI tract is actually to create peristalsis, to create motility, so that you can move things along. And we know things like poor diet, antibiotics, and high stress can lead to this microbiome disturbance within the gut that then not only impairs absorption of nutrients, but decreases serotonin and also decreases GLP-1. I want to manage this by working on the stress in the gut first. We always say, when in doubt, go to stress, go to gut. This is also more important when you've got bone density loss. Here's a question I want to pose to you.
Muscle.
It is muscle, the ultimate longevity organ. We talk about that all the time. This is what I wish we could talk to every teenage girl about. It's not about being lighter or smaller or fitting into a certain size. It is about being strong, and it is about building this healthy structure for your future. The muscle you build in your 20s becomes the muscle you keep in your 50s and beyond. And if you don't have that structure built in during early age, this is when one of those metabolic back doors to long-term health becomes open, where you have the double whammy of the low estrogen and the loss of the lean muscle mass because you never took the time to build it early on in life. This is everything. When you have more muscle, you have a stronger immune system. When you have more muscle, you tend to have better balance. You have more confidence as you go through life. You feel stronger in your own skin, so that if something were to happen to you, say you get cancer or you're in an accident, you're hospitalized, your body can use this reservoir of amino acids and structure in order to help you heal. And your likelihood of coming home from the hospital becomes much more probable by simply having this reserve of healthy tissue. There's been recent literature even showing movement, muscle building with cancer patients. The outcomes are much better. And there's this thought that it might be due to the disturbance of certain tissues during the shear stresses associated with loading of your muscles with resistance training that might actually help kill cancer sooner. We'll see more as more of that information comes out, but I find that highly fascinating and another reason why we believe that muscle is the ultimate longevity organ. Sedentary lifestyle reduces everything good. Bottom line, your bones, your muscles, your brain, your blood vessels. When I am weak and I am unstable, I have no confidence. If I have balance issues, I'm more likely to slip and fall and break my wrist. Age related muscle loss increases your fall likelihood and it increases your fracture likelihood. So, keeping that physical exercise, keeping that protein consumption, managing soft tissue mass and muscle is absolutely imperative to your long term success throughout the postmenopausal phase. Here's a key concept that everybody should know: the gut brain. I'm sure you've heard that the gut is the second brain. Did you know that the enteric nervous system, the nervous system within the GI tract, is our largest nervous system? And it's constantly communicating back to the brain via the vagus nerve. The vagus nerve is the wandering nerve. It comes from our brainstem and it goes all over our abdomen and thorax to distant reaches of our intestine, all the way from our stomach and our pancreas down into our intestines. Its job is the primary nerve of rest and digest. Oftentimes, we are living in this state of fight or flight. This chronicity of fight or flight is the chronic stress response. We know the more rested and calm a brain is, the more rested and calm a GI tract is. If you think that the reason that you get constipated when you travel is because you don't have your fiber or your magnesium or your smooth move tea with you, you're most likely sorely mistaken. Oftentimes, people don't poop as consistently when they're traveling because their stress is higher. Their routine is off. They don't have adequacy of vagal nerve. That is a common driver of the constipation associated with traveling. When we think about this gut brain axis, we've got some brain structures, the hypothalamus and pituitary, really the master controllers of the adrenal glands, of the thyroid, and of the ovaries. And then we've got the feedback response that happens as the body senses, as the gut senses certain inflammatory proteins within the GI tract, things like a dairy or a gluten that you might be sensitive or allergic to, things like a salmonella infection or a norovirus infection. That information is being sensed by these chemoreceptors within the GI tissue that are quite literally sending the information back to your brain, where the brain can coordinate an immune response through the tissues in order to kill that infection. If, let's say, this is coming from a food that you're eating that you're sensitive or allergic to, the brain is constantly going to be inflamed now, simply sending out information for your body to kill this air quote infection or this antigen. The problem is we're eating it twice a week or 3 times a week, so you're never getting that calm. When it comes to food allergies and sensitivities, they're a common driver of leaky gut. And we know that leaky gut is one of the primary instigators of the relapse or of the flare of almost all autoimmune conditions. Truly, the gut is the center point of our health or our ill health. And if you're eating foods that you're reactive to even once every couple weeks, I always say you might as well eat them all the time because your immune system is not discerning in the sense of casual levels of things. If it senses a food that you're reacting to, it will react every single time toward that seemingly antigenic material, that disease causing material. And this is how, when people are almost gluten free, which we hear a lot of our patients say, I'm 90% gluten free, they don't truly understand the effects that the immune system is experiencing due to that instigation, because they're not truly getting it out of their system. Taking care of your gut brain axis is the crux of the ability to manage stress, especially associated when we have less estrogen in menopause. Chronic stress kills. Stress kills. Your immune system becomes activated. We're going to deplete minerals. When minerals are depleted, the heart needs to get them from somewhere, because the heart uses calcium in its relaxation phase, and that's going to contribute to weakened bone structure over time. Here is that gut brain axis in a uglier, more technical way than on the previous chart. This was from 2015 in the Annals of Gastroenterology. Whoops, I had to take a break there with that Freudian slip. In the Annals of Gastroenterology from 2015. When we think about this bidirectional brain gut microbiota axis, that's a lot of words there. Essentially, here's what I want you to take from this slide. A few things. GABA. That's one of those words on that right side. GABA is the principal relaxatory neurotransmitter within our nervous system. GABA is driven strongly by progesterone. GABA helps us be calm. GABA regulates our circadian rhythm, and GABA helps us get to bed at night. When we don't have GABA, we are going to be more anxious, and we are not going to be able to settle in at the end of a night, and that's really going to affect the circadian rhythm. So if I know that my declining progesterone levels associated with not being in an ovulatory state during the second half of my life, if I'm a postmenopausal woman, I need to do everything else that I can to increase GABA, whether it be bioidentical progesterone or simply eating the right foods and practicing the right self-care techniques in order to increase GABA. Those are going to be things that I need to utilize. We work with women in this phase often on, we'll even for short term, potentially longer term, give them supplemental GABA. It's highly absorbed through the mouth when we gargle it, or we stick it up in our upper lip as a buccal troche, and it can actually give the brain this necessary chemistry in order to really relax. When we think about BDNF, that's a growth factor in the brain. Women postmenopausal with low estrogen tend to have less BDNF, but this is something that we can increase with physical exercise. This is something that we can increase with certain mushrooms and other nutrients where we know we might not have the estrogen around. But again, this is one of those back doors where we can fill in the gaps lifestyle wise in order to mitigate most of these brain related symptoms associated with this postmenopausal state. This is a fancy chart from one of our blog posts. Here's what I like to tell my patients, and this is why chewing your food is so important. Again, the vagus nerve is associated with the rest and digest state. It principally opposes the fight or flight state that so many of us are living in. When I chew my food, that mechanical loading in my jaw strongly simulates the brainstem. The brainstem is the house of the vagus nerve. It comes from the brain and it wanders all over the thorax, like we said earlier. As I'm chewing, I'm activating that vagus nerve. As that vagus nerve is active, it drives cells in my stomach to secrete stomach acid. I need stomach acid in order not only to digest my food, but to prevent foodborne illness. I always say, when we eat raw food, there's a good likelihood that there's some manner of E. coli or salmonella on those products, but because we have adequate stomach acid from chewing, we don't have to get sick. The pH change in the stomach is one of the best ways that I can prevent heartburn. It's one of the best ways that I can prevent acid reflux from other causes, and it's also one of the best ways that I can drive normal downgoing motility. As that vagus nerve is churning out these parietal cells in the stomach to make acid, that signifies the vagus nerve activation of the pancreas to secrete pancreatic digestive enzymes. Both of those are needed in order to tell the gallbladder to secrete to secrete bile. If I don't have bile flow, I tend to become static in my gallbladder and stasis, cholestasis, tends to create stones in the gallbladder. This is another example when a woman gets her gallbladder ripped out, where we're blaming the victim, not the perpetrator. This high stress, rushed meal lifestyle, maybe we're taking proton pump inhibitors, we're drinking too many liquids during meal times, we're always eating on the go, leading to this poor vagal nerve tone, which then never causes the stimulation of bile flow from the gallbladder. And that eventually leads to this sitting around and this sludginess of the bile, which can oftentimes become stones. And then we go in and we rip out this necessary digestive organ, all because we saw that there were stones in it. This is an example of the preventative focus that we try to lean into with people. If you have a history of gallbladder stones and you still have a gallbladder, we are going to do everything we can to stimulate good vagal nerve tone to make sure that we continually drive the secretion of bile from the gallbladder. Sidebar, another issue we see oftentimes with gallstones is thyroid dysfunction. I tell my patients that the gallbladder is like a cement truck. It needs to be constantly secreting bile. It needs to be constantly in motion. Thyroid hormone and vagal nerve tone are the principal instigators of that churning action that keeps everything moving along. The vagus nerve also drives blood flow to our intestines so that we don't get bloated when we eat. You might notice your bloating doesn't come from a specific food, but it comes from the volume of food you eat. If you can eat 5 carrots or 5 pieces of broccoli, but you can't eat 12, oftentimes that's not a sensitivity or an allergy we're talking about. That's actually poor vagal nerve tone. So if you have any of these foods that seem to be a volume issue for your response more than they are the food stuff, I challenge you, pull the liquids out of that meal, have a very intuitive meal when you eat it, really chew, maybe try humming before you eat, and really getting into that vagal nerve tone to see if that will help you have less of that response after your meal. This is all vagus nerve. And then one thing that we think of with chronic inflammation, back to that fancy chart in the beginning, there is a cholinergic anti-inflammatory pathway through the spleen. The spleen is responsible for making all sorts of inflammatory signaling molecules called cytokines in the body, which essentially tell the body to make more inflammation. It becomes this feed-forward response where the body works to kill threats. Adequate vagal nerve tone through all of these activities that we're mentioning, like humming or gargling or chewing your food, even acupuncture points, can stimulate this reflex arc within our spleen where the vagus nerve actually activates this cholinergic pathway that tells the spleen to make less inflammation. So quite literally, you not chewing your food is a profoundly inflammatory activity. And chewing your food is profoundly anti-inflammatory. You were born with this mechanism, so make sure you're engaging with it. And he said it just as good as I said it. Dr. Karazian talks so much about how the gut, oftentimes gut problems are a result of this poor vagus nerve activity. Now we're going to have Kate step in here and talk a little bit about the common nutritional pieces that we work on in this population.
Okay, so we've reviewed a little bit about what to expect in perimenopause and postmenopause and the why behind it. So now let's talk about some of the applications of nutrition concepts to help you best navigate the symptoms associated with this transition. I want to start with the big picture. Why does nutrition matter so much during perimenopause and menopause? Well, our hormones are like an orchestra, and during this transition, some instruments start playing out of tune. ChatGPT wrote that for me, but I really like it, so I'm going to keep it in. So we've shown you that estrogen and progesterone fluctuate. Cortisol, the primary stress hormone, can spike more easily, and that our metabolism isn't quite as efficient. But the good news is that you do have some control by manipulating your food choices. First, blood sugar balance and glucose regulation is key. When we eat too many refined carbohydrates or go too long without eating, we get blood sugar swings that lead to energy crashes, mood dips, even increased fat storage, especially around the midsection. So by focusing on balanced meals with protein, fiber, healthy fats, we can keep our blood sugar more stable. Second, we've got to think about inflammation. As we've shown, chronic inflammation can make menopause symptoms worse. So the hot flashes, the joint pain, the brain fog. So an anti-inflammatory diet, which is one that's rich in colorful vegetables, omega-3s from fish, nuts, and seeds, and minimal processed foods can help keep that fire under control. Finally, gut health. Our gut microbiome plays a huge role in how we process and detox excess estrogen. So if digestion is off, this is where we see symptoms like bloating, more weight gain, and mood swings again. Eating fiber-rich foods, fermented foods, and staying hydrated are all ways that we can support smooth estrogen metabolism from a gut health perspective. So now that we know the why, let's talk about some of the key nutrients to prioritize. These are what I call the MVPs of menopause nutrition. First up, protein. We naturally lose muscle as we age, and that slows down the metabolic rate. We also know that protein helps keep us full, helps stabilize blood sugar, and supports the neurotransmitters we need for positive mood. So I want you aiming for quality sources of both animal and plant-based protein, things like poultry, fish, eggs, tofu, beans, and dairy sources if you tolerate them. Healthy fats are also important here because hormones are made from fat. Avocado, nuts, olive oil, fatty fish like salmon, and sardines, my favorite, can help with brain health, mood, and inflammation. We already get plenty of omega-6s in our diet, so we have to actively prioritize these omega-3 rich sources. Fiber is another powerhouse, mostly from vegetables, fruits, legumes, and seeds. It will support digestion, again, helping to eliminate that excess estrogen, which can reduce the symptoms of bloating or breast tenderness that can happen in that perimenopause state where estrogen is kind of all over the place. Some nutrients like magnesium and B vitamins are key for stress, sleep, and energy, and that's where leafy greens, nuts, seeds, and whole grains are good sources for those. And then finally, phytoestrogens. These are compounds that are found in flax seeds, soy, and sesame seeds that can really gently support estrogen levels. They work to mimic estrogen's effect in the body, so they can be really powerful for easing those symptoms during the transition. So let's talk about some real life solutions. What can you do today to manage some of the common menopause symptoms using food? If you are experiencing hot flashes and night sweats, alcohol, caffeine, and sugar, 3 big vices, 3 big triggers. Try swapping out your coffee for an herbal tea, reducing your alcohol, and of course, making sure you're staying hydrated. Cooling foods, if we're thinking about an Ayurvedic perspective, cooling foods like cucumbers, leafy greens can also help with that heat sensation. When you are struggling with sleep or insomnia, often it's blood sugar dips at night that are waking you up. So I like to try having a protein-rich snack before bed, something like a handful of nuts or some Greek yogurt. And then magnesium-rich foods like dark chocolate. Yep, really dark chocolate. Pumpkin seeds and leafy greens can also help with that relaxation response. If you are someone who's struggling with weight gain, especially around the belly, going all the way back to insulin resistance and blood sugar control. So protein, fiber, and healthy fats, and minimizing those ultra-processed foods. At the same time, not a nutrition, but an essential lifestyle hack. Strength training is a game changer for metabolism here. And then mood swings, anxiety, brain fog. This is where I really dial in the omega-3s from fatty fish, sardines again, walnuts to support brain health, and then gut-friendly foods like fermented vegetables, yogurt, whether dairy or non-dairy, that has some probiotics can also positively impact the mood by supporting those neurotransmitters. So the bottom line here, food can be a very powerful tool for feeling better through perimenopause and menopause, but it can be small shifts like prioritizing protein, reducing sugar, supporting your gut health that can make the biggest difference. So now I'm going to pass it back over to Dr. Mitchell to dive deeper into some specific supplements that might be relevant to manage symptoms, promote overall wellness during perimenopause and menopause.
Good. Appreciate that, Kate. And food is truly medicine. Sometimes food gets poo-pooed as an afterthought. Meanwhile, people are doing their cold plunges and their saunas and their NAD drips, all the things that we hear about that people are willing to do. Their red light exposure, but they're not doing the big triggers, which is your stress management, your sleep, and your diet. Don't be someone who majors in the minors. Let's focus on the big things, and then let's use those smaller levers once everything else is in place. Supplements are no different. You cannot out supplement a bad diet and high stress. Supplements are here as a way that we use to create biological shifts, but they will certainly never overtake poor stress management and a poor diet. One of the first easy once a day packets that we talk about with women who just want kind of a catch all, if you will, where it's easy adherence. You get a canister, you take a packet a day. We've got our fish oil, we've got our B complex, we've got our nutrients, our minerals, and we've also got some phytonutrients. This is not something that we typically utilize in the clinic because we're doing specialized testing and we're really honed in, but this is a good option for those who want to get started with some basic nutrients without a whole lot of risk involved. And they're high quality, they're pharmaceutical grade, and it is going to generally cover your bases. I like to get much more specific with women, specifically when it comes to lean body mass. We talked so much about sarcopenia and muscle being the longevity organ. When it comes to muscle, we need nutrients, we need protein, we need loading. And we use bone support a lot of times, even with younger females who have a history of stress fractures. It's a great combination. It used to be thought that any old calcium is effective, and we now know better. We like to use a specific type called calcium hydroxyapatite, which has actually been shown to increase bone density, but we never like to give it on its own. We like to make sure that the person at the same time has adequate creation of stomach acid. So you're going to take this with a meal. We're going to add some phosphorus, and the bone support extra strength has that phosphorus in it. And then we're always going to dose in some vitamin D3 with K1 and K2 based on your unique blood work. Taking 10,000 units of vitamin D a day is not dangerous if you need it, but it could absolutely be unnecessary if your blood levels are not indicating that need. So vitamin D is one of those things that we highly recommend. Those levels get tested multiple times throughout the year so we can really dial it in. And then when we take a high level, such as 5 or 10,000 units a day, based on a patient's blood work, we're always going to give that with vitamin K2 in the form of MK7, which is a natural form of vitamin K2, because studies have shown that vitamin K2 is highly protective of blood vessel and heart function. Taking too much vitamin D without K2 can actually lead to calcification of blood vessels. It can cause a couple things to happen. Number one, it will cause you to actually absorb more calcium within your gut. And number two, it could trigger your kidneys to retain more calcium, which can lead to kidney stones, as well as potentially calcification within your blood vessels. So we're always giving vitamin D3 with vitamin K1 and K2. And then magnesium. So many different forms of magnesium. We're going to talk about a different one that goes to the brain in a little bit here. But when it comes to a very highly absorbable, affordable, safe form of magnesium that doesn't lead to bowel issues like diarrhea, it's magnesium glycinate. Magnesium is responsible for hundreds of processes within our biology. One of them, when it comes to bone health, is it actually triggers the activation of vitamin D. So these tend to be synergistic effect where we'll give all of these together, and then we've got protein. If you're taking protein, you got to make sure it's clean. I don't want something with 47 ingredients and half of them are proprietary blends. I want a grass-fed whey protein. I want a whey protein isolate, and I want a whey protein that doesn't have soy in it. So many of the emulsifiers within proteins are soy. So you might not actually have a sensitivity to your whey protein that's causing your bloating. Maybe it's some of the artificial colors or flavors in it. Maybe it's the soy lecithin that's in it. Or maybe it's the impure form of whey protein that's in the cheaper supplements, which is called a whey protein concentrate. So the Nutridyne grass-fed whey protein uses just a few ingredients. There's no soy, and it's a whey protein isolate from grass-fed cows, so that we're truly getting down to the most key portion, which is getting that adequacy of protein. Blood sugar support. Berberine is oftentimes called nature's metformin. I think that's wrong. I think calling it nature's metformin is doing berberine a disservice. Why do I say that? Berberine has many of the same effects, such as improving insulin sensitivity and increasing glucose uptake into our cells, as well as decreasing the production of glucose in the liver, which can help to lead to more stable blood sugar overnight. But whereas metformin actually harms the creation of energy through our mitochondria, berberine improves the function of our mitochondria because it activates an enzyme system known as AMPK. AMPK is a potent driver of energy production, and metformin actually does not have the same effect. We often know a side effect of metformin is poor energy production because it harms the mitochondria. So we find berberine to actually be a much more effective first line for someone with borderline blood sugar dysregulation before jumping to something such as metformin. It's all about sleep and stress management. These are multiple formulas that we may use with somebody depending on what they have going on. Magtine is really the interesting one for us. I take 3 capsules about an hour before bed. I have so many of my anxious or patients with ADHD, but then all of our postmenopausal women, this is a mainstay for us. Magnesium threonate has been shown to cross into the blood-brain barrier, so it actually gets into the brain. This form is not effective at raising whole body levels because in one 3 capsule dose, you're only getting 144 milligrams of magnesium. Whereas the magnesium glycinate, 2 capsules gives you 260. So that's much easier to dose at higher levels and it's much cheaper. Magtine will cross into that brain, will bind a certain receptor within the brain called the NMDA receptor, which allows us to not only save neurons and keep our brain healthy, but it will allow us to be less anxious and more calm in the evening, which allows us to get better sleep, which then promotes better stress management and insulin control, which then allows us to move more during the day. So as you can see, adequate brain levels of magnesium quite literally set us up for success for the rest of our biology. And here's some things that we utilize often from an adaptogenic or a hormone perspective to help with stress and anxiety support. DHEA, this form of DHEA is great if someone isn't looking to impact sex steroids. We know DHEA, it's an adrenal hormone that converts in the body into sex hormones. A postmenopausal woman, I don't know if you know this, but you will still have, as long as you have your ovaries, you will still be making testosterone from your ovaries as well as your adrenal glands. So sometimes these women are not looking for forms of DHEA that will increase testosterone. This is when we'll utilize this salt of DHEA called 7-keto DHEA, which doesn't convert into the sex steroids. It simply helps balance out your cortisol and raise your resilience to stress, as well as help you create active thyroid hormones within your biology. The other 3 that we see here, all different formulas. We use dozens of different stress formulas from things like cordyceps and ginseng to holy basil and morel mushrooms, all the way to GABA, L-theanine, or even things like ashwagandha and rhodiola. It's all dependent on patient need, and we tend to like to cycle these through the body. And then this is a little more information on GABA support. This is actually GABA in a pill with L-theanine. We can take it this way. We can take it in a way that we gargle, depending on how quickly someone needs it. This is a great product to take before bed or before a stressful flight and things like that. It will absolutely, at that dose there of GABA, it will absolutely help you calm down. We also will talk about hormones just for a second here. There are some bioidenticals that are lower doses than, say, a prescription, and they tend to be a nice introduction for most people into the hormone replacement therapy world. Dr. Felice Gersh, who's a world-renowned gynecologist and integrative medicine practitioner, she made a great point about the Women's Health Initiative a while back that showed and stated that exogenous hormones were dangerous for postmenopausal women, where they said that had an increased risk of cancer and things like that. And what she says is, well, when you look at the studies, the hormone discussed was Premarin, which is a synthetic form of estrogen that's actually from a pregnant mare. They take the urine from a pregnant horse and they pull those estrogens out and they create a synthetic form and they give that to women. And her example was this would be the same thing as if we were to take strawberry flavored candies and we saw that they cause diabetes and heart disease. So our claim is that strawberries cause these problems. As you can see, that's quite ridiculous. If a synthetic form of estrogen cause an issue, that does not mean that a bioidentical form would. And the point she makes is when you're 50, estrogen doesn't become all of a sudden bad for you or dangerous. Estrogen is a hormone of life. It is not so much a sex hormone as it is a hormone of life, from the proliferation of healthy blood vessels and brain tissue to blood sugar and circadian rhythm control. And it's not that now postmenopausal you're better off without the estrogen. The claim she makes is that it would be simply deleterious and dangerous for a woman at 60 years old to become pregnant and to then go through the rigors of childbirth. So essentially you have to throw out the good with the saving of the woman from dying during childbirth. And that's what we see with this withdrawal of estrogen. It doesn't mean that estrogen is bad when you're 55. It simply means in order to make sure that you don't get pregnant, the hormones must change. And because of that, there tends to be other side effects. So that's what I want you to take from this is estrogen does not become bad and dangerous to you just because you're 55 years old. From a non-hormone perspective, we have certain adaptogens. Estro-G is a fascinating blend that doesn't seem to impact sex hormone levels at all, but it does a really good job of inhibiting some of the vasomotor symptoms associated with the perimenopause or even the postmenopausal state. Milk thistle helps raise glutathione levels, which is the master antioxidant in our body. It's also tends to be pretty healthy for liver cell function. The liver is where you transform all of our estrogens, or primary spot of estrogen metabolism. And then ashwagandha is a very calming herb that tends to help with anxiety. So that's a fascinating product. And they also, we talk about ovarian support. Chasteberry, we use that from things like PCOS and endometriosis all the way to just trying to help a woman restart cycles after getting off birth control. And that's an option during the perimenopause phase. Again, if I can help save a few more cycles for you, everything is going to be better years down the road. And a very similar product here is the menopause support. You know, we see that addition of the black cohosh, which I find is a great way to promote cognitive performance and brain health. Sleep tends to improve quite a bit on this. Here is my top singular mediator of inflammation in my toolbox. PRM Resolve, pro-resolving mediators. When we talk about this a lot with patients, when you get inflamed, the body secretes a class of white blood cells that are called neutrophils. Neutrophils are floating around in our blood vessels all the time. They're a white blood cell. And when there's damage or a pathogen, there's a sensing that happens within that damaged tissue where it actually causes the blood vessel to release these neutrophils into the area. Neutrophils come in, they tend to gobble up whatever the pathogen is, and then they send a signal out to the blood vessel where the blood vessel is supposed to release another compound of a white blood cell called a monocyte. And the monocyte's job is to come into the tissue, turn into a macrophage, which means big eater, gobble up the neutrophil, and then clear it out through the lymphatics. The problem is, there's a few problems, but a big problem is when that neutrophil first comes into tissue, it only has about 6 to 10 hours in order to be gobbled up by that macrophage, or else it will trigger death within the tissue called necrosis, secondary necrosis. That is a hallmark of chronic inflammation. Neutrophils come in, there's not enough of a stimulus to drive the monocytes to come in, and then the neutrophils degrade into the secondary necrosis, where it triggers more neutrophil influx. And you can imagine if the response by the immune system was not robust enough the first time to clear the neutrophils, there is not going to be a chance that your monocytes can clear on the second time, because you become more neutrophilic, more inflamed, more irritated in that tissue. PRM Resolve takes fish oil, EPA and DHA, and it actually is the converted forms into these mediators that help, what I like to say, unclog the drain, where I can drain that inflammation. I can perform this switch with these proteins and these white blood cells so that now the inflammation has a chance to be modulated or mediated. It is not anti-inflammatory, which is why I said inflammatory mediator. It does not suppress the immune response. It is not like a corticosteroid that actually makes you more prone to infections. This simply helps your body clear what is naturally happening. So for that reason, this is a first line intervention for patients who have chronic inflammation, because I know I need the inflammatory response. I just need to be able to quench it and pull my biology back to homeostasis. I need to get out of that chronic low level smoldering forest fire, and I need to be able to clear that so that the next time I'm inflicted or encounter a pathogen, I'm able to have that blistering hard blowtorch like effect toward it and then clear it again. So PRM Resolve is a great way that we help provide the body with these mediators of inflammation so I can unclog the drain and I can become overall less systemically irritated and inflamed. And if, as we talked about in the beginning, if I'm less inflamed chronically, everything gets easier. And here's really the message of tonight. This is not the end of your story. This is that slide, I wrote it. It might be a little bit corny and cheesy, but it is absolutely true. You might spend half of your life in the postmenopausal state. You do not need to suffer needlessly. You do not need to be gaslit by providers into thinking, well, it's just my hormones. There's nothing I can do. There is so much you can do. There is so much that you can manage. There are so many targets to attack. And this should be a point of hope and excitement for you that this is not the end of your story. This is the beginning of a new chapter. You are empowered, you can take control, and you can take these tools to truly make the next chapter of your life a beautiful thing. Thanks for joining us tonight. I really appreciate your time. I hope you learned at least a few things, and reach out if you have any questions.